Let's now bring in Dr. Andrew West. He is the Chief Executive Officer for the Canadian Society of Respiratory Therapists. He joins now from St. John's, New Brunswick. Doctor, good evening and thanks for joining us. Really appreciate it.
Good evening, Akshay. Thank you for having me.
So we do understand COVID-19 is, of course, a respiratory virus, and a lot is being spoken of how there is a need to come up with further equipment, medical supplies, etc. Ventilators being one of them, Doctor. If you can throw some more light, where are we in Canada when it comes to ventilators, and what's the need at the moment?
Yeah, I mean, that's a really important question, and we're really pleased to have the opportunity to speak to it. As you displayed in the clip just before this, the federal government right now is undertaking a procurement process to bring in about another additional 500 ventilators into Canada. But I think, taking a step back in that conversation and thinking about where it is that we're at right now is an important piece to discuss. So, we know that there is in normal years an adequate supply of ventilators across Canada, and we have experience in that demonstrating our system capacity is such that it manages our normal influx of influenza, for example, patients each year. But we anticipate some increase with COVID-19, and we're with respiratory therapists across the country are being quite cautious in the way that they're approaching this because we just don't necessarily know the numbers that we're anticipating. So when we look at a normal the normal fleet of ventilators, if you would say, across the country, we have approximately 5,000, so we're told by the federal government. And we know that there are stockpiles in local hospitals and in health regions across the country managed through the provinces. So we know that there is some additional supply ready should there be surge in demand. Yeah.
Dr. West, we also heard from the Prime Minister, we are hearing from premiers of different provinces as well, saying that we're going to retool the manufacturing sector. Those companies and manufacturers can help in producing medical equipment. They should come forward, and Ottawa is going to try and help them as well. I want to understand from you, manufacturing a ventilator, what really goes into it? How many days does it take to come up with an equipment of this importance?
Yeah, and I don't think that I can speak specifically to the manufacturing process and to how long that it takes for each of those companies to build a ventilator, but I know that there's a substantial amount of research and development that goes into them in the background. So, the Canadian Society of Respiratory Therapists applauds the federal government for taking this step. We think that it's a really important one to be proactive and to move not just with procurement, but the idea of retooling the manufacturing sector to help to prepare with additional ventilators. That's something that's going to take some high degrees of innovation, and that takes teamwork and collaboration. So respiratory therapists across the country stand united with the federal government in that and stand ready to participate and provide their expertise in that process.
And very briefly, Doctor, where else are we feeling the pinch in terms of equipment?
I think that what we're hearing from respiratory therapists across the country, and those are the health professionals who are really taking the lead in caring for patients with ventilators and managing those ventilators. Their concerns, equipment-wise, besides ventilators, lies a lot with the personal protective equipment that they have available to them. We haven't been hearing from them that they're facing dramatic shortages at this point in time, but they, of course, have concerns if scarcity was to become an issue.
All right, we leave it at that. We appreciate your time. Dr. Andrew West, Chief Executive Officer of Canadian Society of Respiratory Therapists. Thank you.
Thank you very much.